Let me let them introduce themselves.
The National Ebola Training and Education Center, or NETEC, recently met for a conference at Emory University, where infectious diseases experts shared ideas about how best to get ready for the next epidemic of a serious communicable disease like Ebola.
There's a well-known saying that failing to prepare is preparing to fail.
Dr. Bruce Ribner is head physician for Emory's Serious Communicable Diseases Unit. He and his team were first in the nation to receive patients with Ebola in 2014.
If the United States ceases to devote the resources so that healthcare workers and their administrative support do not continuously practice how they will manage an infectious disease outbreak, that we will not be able to manage the inevitable infectious disease outbreak when it occurs on the United States shores.
I don't think many of us were completely prepared for Ebola back in 2014, and so we never want to be caught off guard again, and that's what NETEC is. That's why we have NETEC.
We're going to use Ebola to create this model of clinical care and really for resource and training in order to take good care of patients, but also to keep our healthcare providers safe.
And NETEC has made progress since the epidemic abated, like establishing safer and more efficient clinical protocols and refining methods for quick turnaround times on research studies.
I think with the next outbreak, we have a robust research program in place so that we will rapidly begin to evaluate therapeutic, preventive vaccines, and also medical countermeasures.
But some benefits of readiness may be more apparent than others.
I think outbreaks of high consequence infectious diseases naturally invoke fear in people and in the population. And I think that preparation ahead of time to assure the public that we have this as under control as it possibly can be, that the system is prepared, that our healthcare workers are prepared, is probably the best way to tamp down that level of natural fear that occurs in response to an outbreak.
Through shared knowledge and training, NETEC members continue to refine best practices and have also helped to assess the readiness of other treatment centers throughout the U.S.
As a collective, we've improved that greatly with the 10 regional treatment centers and a host of other hospitals that have devoted a lot of time and effort to preparing. But as a nation, we still have critical gaps that exist.
The goal here is to continue to increase the capability of the country's public health care systems in order to safely and effectively manage patients who have been stricken with a deadly and contagious pathogen.
The next outbreak is a matter of when, not a matter of if. And we need to be prepared.
So we've been working closely with them.